Okay, so we got another instrument here. We got a neural hammer that actually has a needle. We do sharp dull. The needle's on the top, and then here's the brush. And we're not going to use that one. That one's another method for soft touch. So let's go with proprioception, and that's the ability. That's really like a protective threshold, and that's the ability to feel this monofilament. The pressure that you feel when this bends is a certain standardized pressure. So you're going to want to tell me if you feel something, and then which foot and where specifically. So you have to tell us which foot. Some people it's confusing and they can, this side and that side, that's fine. So I think you're capable. Left, right. Okay. So, all right, close your eyes and tell me.
Left heel. Left hallux. Right pinky. Right heel.
And if they have real thick calluses, you kind of want to go just where there isn't real callus. Nobody's going to feel through thick callus.
Right hallux for both of them.
Okay.
Left on the left side, probably middle.
All right.
Left top of foot.
Okay. And then, so what we'll do is we'll follow those. We'll do each of those points at least. That's what we're going to want to do, and we're going to want to, be writing them down, whether they felt it or not. And with our legend, it's P means present, they felt it. A means absent, they did not. And you can do up to 3 chances. Sometimes they're just,
They can't
there's other stimulation, and they can't really, settle down and then really feel for it. So if they didn't do it, give them another chance at least at those. So that's proprioception. We've done vibratory, and then we go to sharp dull, and that's going to be again using the instrument. Again, you got to be careful. Obviously, somebody with real thin skin, diabetic, we don't want to create an ulcer. So sharp and dull. And usually you can just tell them, okay, this is sharp, and then this is dull.
Okay.
All right.
Am I telling you placement too, or just whether it's sharp or dull?
Whether it's sharp or dull.
Okay. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Dull.
Okay, yeah, you got it that time, right. Yeah, and this is pointy enough, should be able to feel that. So, so somebody with neuropathy, this is going to be a real difficult exam, and you'll know when they're kind of guessing. And then we'll do the pulses. We want to try and do the three arteries. So, typically, you guys know, where they are. They can vary, in a lot of people, but essentially, 99% of people are going to have the DP right on top, and I would go just to the lateral aspect, start at the lateral medial column, and then go there, so right here I feel a nice bounding, DP pulse. So that would be, we would say 2+. 3+ is if you can just see it bouncing out of the skin, so normal would essentially be 2+, or +2. +1 you feel it, but it's kind of weak. 0, you don't feel it at all. So you go there, and then right inside here, posterior tibial, people who have a lot of edema, if you put, probably what we should do is you put, if you don't feel it because of edema, just put, too much edema. Too hard to feel it through, an inch of fluid. And I like to use, these 2 fingers. These are typically the ones. This one is, index finger usually has a little less feeling because you're using it more. So these are going to be the ones that are. Okay, so I can feel it there. The peroneal is difficult. It's even difficult to pick up on a Doppler sometimes. So, I'm not that concerned with it, but just to be thorough, do, you find the lateral malleolus here, and you just kind of work your way up, and you go a little bit high on the ankle, not down here, but this is going to be where you would feel it. Did you quit smoking finally?
I never smoked.
Oh.
My parents did.
Did they? That's
Yeah.
why you don't.
Mm-hmm.
Good. Okay, so I can't even say, well, there I can feel it. But this is a smaller artery. It's weaker in general, so it's not that big of a concern, but you know, we have it on there, so let's at least check it. Capillary fill time. You know, have good lighting here. Basically, that's, you know, how quickly the capillaries fill up when we push the blood out, and you just count. 1, 2, 3, 4. So he's right basically a little less than 3, we'll say. And normal is less than 10, so there can be people, smokers, you know, where there's vasospasm, you know, it could be an indicator, Raynaud's phenomenon, or just, you know, poor arterial supply. So, and I would do each side, maybe, you know, just do the big toe, and we're fine. Okay, so that's it. Do you guys have any questions or anything I didn't cover?
I'd like to watch the first part of the video too.
Yeah, where I go over everything, right? Because again, we talked about this area here, right? Where I'll designate how often the exams need to be done. Okay, that's it.